Now, I've talked a lot about why it is so important to do biomarker testing, which I hope to convince you that that is the case. But we also know that there's a lot of steps and missteps that can occur of getting the right treatment to the right patient. And this is a fantastic article that was published on just about 40,000 patients in 2019 with advanced non-small cell lung cancer who would have otherwise been eligible for biomarker testing per our guidelines. And this is based on Medicare as well as private insurance data. And they looked at the different steps in which biomarker testing was either not completed, not ordered, or just didn't reach the patient in time. And it can start with something as simple as it just was not even done. A biopsy wasn't done, or the biopsy was insufficient, or the physicians did not order the test, or insurance denied paying for the test. The test could have been at the end not conclusive because the tissue was insufficient, and it was only discovered at the time the testing was done. But if you look at step 7, which is the last step, targeted treatment was not selected despite having a positive test result. That means even when faced with the right biomarker, the treatment was still not delivered. And I think that speaks to the importance of education, right, for the patient, and that's hopefully why you're here today, but also for your doctors and everyone else in your care team. Being educated about what these biomarkers are and what treatments are approved for these biomarkers is really important to make sure we deliver the best care to our patients. And so my take-home messages are that molecular testing, biomarker testing, is key to determine treatment for patients with non-small cell lung cancer. And in fact, these biomarker driver mutations, like we call them, are like locks, and they really need the precise key to unlock them to lead to a better cure and treatment option. And finally, I think continuing education is critical to ensure that the correct targeted therapy is given to the right patient. And I want to thank you for your time.